Hi, there's a good chance that you or someone you know has firsthand experience with diabetes. If that's the case, in this program, Diabetes You Are in Control is for you. Welcome. My name is Lori Wellner, Health and Food Safety Agent with K-State Research and Extension in Wyandotte County. We have a lot of ground to cover in today's program, so let's get started. Just a little side note, you'll want to make sure that your volume is up on your computer before we move ahead. This is just a reminder that K-State Research and Extension programming is open to all people. And I wanted to be certain to give a shout out to the 3 individuals involved in bringing this program together. Their names and contact information throughout the state of Kansas are listed here. This is the new publication, but just know the PowerPoint today will highlight most of what's in this fact sheet, but you still might want to get a copy of this for yourself. The link and how to access it is at the bottom of the screen. In the Diabetes You Are in Control fact sheet, there are brief definitions of the types of diabetes, but just know that today's lesson will focus more on that type 2, but most importantly on the choices and behaviors that may prevent or even delay the onset of diabetes. So quickly we'll address those definitions. There are 4, starting with pre-diabetes. Now this is a serious health condition in which blood glucose levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. Type 1 is usually diagnosed in children and young adults, but it can appear at any age. You might have heard that called juvenile diabetes in the day. In this type of diabetes, the cells in the pancreas that are responsible for making insulin have been destroyed. They are not functioning. Type 2 diabetes is the most common type diabetes, making up over 90% of all diagnosed cases. And in this case, the body can't use the insulin that it produces. So over time, the pancreas can't produce enough insulin to keep the blood glucose levels in check. Gestational diabetes or diabetes during pregnancy occur often mid to late pregnancy. And the symptoms of diabetes normally go away after the birth of the baby. In this case, the body doesn't produce or use all the insulin it needs during pregnancy. A woman, however, diagnosed with diabetes in pregnancy is more likely to have type 2 diabetes later in life. In its simplicity and in understanding the big picture of diabetes, when you take in food, it is converted to glucose, blood sugar, within the body. And then of course, an increase in that blood glucose will signal the pancreas to produce and release insulin. Now, insulin is a hormone that helps that glucose to be used by the cell's body as energy. More than 34 million adults in the United States have diabetes, and 1 in 5 don't even know they have it. To be sure, diagnosis of diabetes can be scary, but hopefully this lesson, Diabetes You're in Control, will give you a better understanding of self-management behaviors that will help you live well with the diagnosis of diabetes. And again, understanding that those self-management techniques and behaviors are so critical to help to reduce those complications of diabetes. This is a quick video, about 2.5 minutes, from CHI Health. It dives a little deeper into what diabetes is and how it works. It drags a little bit, so I hope this is working. We'll give it a try.
What's something that's becoming as American as apple pie and baseball? Unfortunately, the answer is diabetes. 1 in 10 Americans has diabetes, and another 1 in 3 has prediabetes. The good news is, there's a lot you can do to beat this disease at its own game. CHI Health is here to tell you what you should know on Diabetes Uncovered. Hi, I'm Dr. Carlos Prendes, a family medicine doctor at CHI Health. I treat people with diabetes every day, so I have seen firsthand that it's on the rise. Over the last 20 years, the number of adults diagnosed has tripled, and it's not something we can ignore. Diabetes is the 7th leading cause of death in the United States, and that's because complications strike every part of the body. The heart, which is the #1 killer, plus nerves, kidneys, eyes, feet, skin, hearing, and more. What's at play is a hormone called insulin. It's made in the pancreas and turns blood sugar or glucose into energy for every cell in our bodies. But some people don't produce enough insulin. They have type 1 diabetes. It's usually diagnosed at a young age, but it just accounts for 5% of all diabetics. When your body doesn't utilize insulin and glucose effectively, or ultimately will end up not making enough insulin, that's type 2 diabetes. It's much more common and it can happen at any age. Without proper insulin levels, your blood sugar levels can soar and damage cells throughout the body. This happens without warning, which is why diabetes can be called a silent killer. 1 in 4 people with diabetes don't even know they have it. So pay attention to these warning signs: frequent urination, excessive thirst or hunger, extreme fatigue, blurry vision, slow healing cuts and bruises, increased truncal obesity, which means a bigger belt, weight loss despite eating more, and tingling pain or numbness in your hands or feet. Diagnosing diabetes requires a blood test, and you may be asked to fast beforehand. Treatment includes insulin and/or non-insulin medications, combined with diet changes and exercise. If a test shows you have pre-diabetes, that means you're on deck. Your blood sugar levels indicate that you are at risk of developing type 2 diabetes, and remember, 1 in 3 adults in the US find themselves in this position. To stay safe from diabetes, start now by losing some pounds if you're overweight, getting more exercise if you're sedentary, and eating a healthy, plant-based, lower-calorie diet with less sugar and fewer carbs. And look to your healthcare provider for help. We're on your team. I'm Dr. Carlos Prendes. Be sure to check back for more from CHI Health Uncovered.
And as I said, if you are not able to watch that video successfully, here's the link that you can just kind of cut and paste into your browser and check it out for yourself. All right, so the question is, are you at risk? There are 6 risk factors that have been identified. Quickly, let's go through them. Being overweight, if you're older than 45 years of age, having a sibling or parent with type 2 diabetes, having an inactive lifestyle, just not moving, having had diabetes while pregnant, and also giving birth to a baby weighing more than 9 pounds. Now, if you have more than one risk factor, for example, being overweight and being inactive, the chances of diabetes compounds then. Diabetes disproportionately affects minority populations and the elderly, and its incidence is likely to increase as these populations grow in the US. Now at the bottom left corner of this screen, you can see that there is a risk assessment you can take. It's only about 60 seconds, and it would be really worth your time if you've not done one yet. So what can you do to reduce those complications and live a life well after having a diagnosis of diabetes? Let's talk about what it means to self-manage your disease. So the diabetes health experts and education specialists have identified 7 key areas to focus on, and we're going to talk about each one of those in a little more detail. Number 1 is healthy eating, which we can all subscribe to. Healthy eating refers to high quality, nutritionally dense food, which means more nutrients in relation to the calories in the amounts that lead to better health and wellness. Now, following an eating pattern that consists of a variety of vegetables and fruits, low-fat dairy, lean protein, whole grains, so most of your grains in the form of whole, and cutting back on the salt and added sugar and trans fats and saturated fats will help you manage diabetes and help you also to reduce those complications of diabetes. So it's really important that you read the labels. So using the plate planning method, and there's a good visual of that here on the screen, to better help you plan meals and snacks will provide a consistent amount of carbs, protein, and fats to help maintain good blood glucose levels. Now, I've included a link to the University Extension Maine. That would be really worth your time to check out. It really goes deeper into the details of this plate method. The next one, number 2, is being active. Any activity, I've always said, is better than none. The physical activity guidelines for adults is to get at least 30 minutes of moderate activity most days of the week. Do something you enjoy: walking, jogging, swimming, dancing, gardening, or any other activity. You want to also to strive to include strength training activities at least twice a week. Now, remember, physical activity is not just about weight loss, which a lot of people think, and that's okay too. But it's good in also reducing blood glucose and cholesterol, but also improving blood pressure. It can lower your stress and anxiety, as well as improve your mood and energy. Now, who wouldn't want that? So again, remember, get moving and do something, because any activity is better than none. Let's move on to 3, monitoring. Monitoring regularly as directed, again, by your healthcare team, is necessary to ensure that your glucose is within those target areas. Knowing blood glucose levels can help you adjust your eating habits and physical activity choices to help your body perform at its best. Monitoring also means that you keep track of your overall health. So knowing your health numbers, for example, those blood pressure numbers, your cholesterol, as well as your weight, is important. Your healthcare team may find that it's necessary for you to use a monitor, and there's an example of one here, to monitor your blood glucose. And if so, they'll be able to help you to use it more comfortably and get familiar with the equipment. The 4th behavior is taking medication. Taking your meds, even when making healthy food choices and being physically active, you may need to take medication or insulin to manage your glucose levels more effectively, which again will be at the discretion of your primary care physician. Diabetes increases your risk for a variety of chronic conditions, so it's important to tell your doctor about all the medications and all the supplements that you are taking. This communication will help avoid potential interactions with medication that you might be taking for some other health condition. Timing is important when it comes to taking your medication or your insulin, as is eating and exercising as instructed and as scheduled. All right, let's move on to number 5, problem solving. When you have diabetes, you can follow your treatment plan, check your glucose levels, all of this to a T, and still find that you don't always get the results that you hope for. Diabetes changes over time. It can be kind of like a moving target, so you may need new ways to manage it. Become familiar with situations that may cause your glucose levels to change. Some of those might include being sick, having the flu, changing times in which you eat when you're on vacation, for example, or possibly visiting family members where your food choices might be challenged, or definitely during stressful life situations. So knowing how to compensate for different situations is necessary to help you self-manage diabetes. Problem solving is challenging, but with time you will improve. But just remember, it is important to be patient with the process and patient with yourself. Reducing those risks. By managing your diabetes, again, by eating healthy foods, being active, taking your meds as directed by your doctor, you can help reduce your risk of diabetes-related complications, such as heart attack, stroke, kidney and nerve damage, and loss of vision. So be certain to get those regular physical checkups by your doctor. Have regular eye examinations, visit your dentist every 6 months, take care of your feet, and most importantly, listen to your body. You know your body the best. And be sure to contact your doctor if something doesn't seem right. The seventh skill, or self-management, is coping. Diabetes is a chronic disease. It is a 24/7 issue. You cannot turn it off and on. So healthy coping is essential. Right here, you can see the quadrant, the good visual of combining your healthcare team with the support of others, family and friends too. Self-managing means to take care of your physical health as well as your emotional health. Managing diabetes, for sure, it can be overwhelming at times. So finding ways to manage that stress in a healthy way is essential because stress can raise blood glucose levels. So getting adequate sleep is just one way to manage stress. Lack of sleep affects our whole body. It can raise stress hormones in the body, which then in turn increases glucose levels. Having a positive attitude about your disease and having positive relationship with others that can help support you is so critical to coping and successfully managing your diabetes. You can live well with diabetes and have the quality of life you deserve with the right type of guidance and the support and using coping skills. Just remember, you are in control. So I encourage you to identify 1 to 2 of the 7 self-care behaviors that we've addressed to focus on for a couple of weeks. Find success in those and then move on to other behaviors until they've all been addressed. And these last 2 slides will just give you some more information on other support and resources that you can tap into. So these are helpful phone apps that you might want to take a look at and try to use and utilize to better manage your diabetes. Here's some additional websites for more information. And I know K-State Research and Extension would appreciate your feedback. So here's a link to provide your comments. And on this diabetes, you are in control. And lastly, just remember, please contact me, Lori Wellner with K-State Research and Extension via phone or email if you have any questions. And again, I want to thank you for joining me for the Diabetes You Are in Control program. Remember to go back to those 7 management behaviors and identify 1 to 2 to work on, find success in those, and then move on. That concludes our program. So with that, I just want to say take care and be healthy.